Hi everyone! So, for my final project, I decided that I wanted to create a mock magazine. This is supposed to be like a medical journal or a women's magazine, kind of a mesh between the two. The topic is being a woman during a global pandemic, what gender differences women are experiencing during a time of crisis. So, I want you to keep in mind that I wrote this with the mindset that the coronavirus is at its peak, that stay at home orders are being issued, people are in quarantine, people are still getting really sick. So on the first page here, I have just included a table of contents of what we are going to be talking about, and then a quote. And that quote reads, "As COVID-19 intensifies around the world, it is clear that if we truly want to deliver health, well-being, and dignity for all, girls and women must be front and center in the emergency responses, in social and economic recovery efforts, and in how we strengthen our health systems post-pandemic." And that was written by Katia Iverson. She is the president and CEO of Women Deliver. So, our first topic is women on the front lines. So, women make up about 70% of all social and health service staff members around the world. This means that the majority of the staff working on front lines facing the pandemic are, in fact, women. 83% of workers who provide social assistance, including children's care and emergency social services, are women. And then right here, I have just included a little graph that shows different healthcare systems. So the black line is nursing, the red line is physicians, and then it shows the percentage of the workers that are women and by their age. So occupations that are most commonly women dominated, such as nurses, flight attendants, and aides for person care, are the most likely workers to contract the virus. Not only this, but they are also the most likely to spread the virus to others as well. Nurses have been seen making their own masks and face shields during the beginning of the pandemic due to the limitation of supplies. Women also do 3 times as much unpaid work care at home when compared to men. Care work includes taking care of the family's health, the elderly, and loved ones who are sick. During a pandemic, women who are caretaking for others directly expose themselves to the virus in order to get a loved one the care that they need. The next topic I wanted to talk about was economic hardships on women in 2020. So, for the first time in economic history, United States women are experiencing the 2020 recession worse than men. And then I wanted to include this quote below that says, "Women are also in the position to suffer the most in an economic recession. Even in good times, women are the most economically vulnerable, comprising nearly 60% of workers in low-wage occupation." That was in the article "Women on the Front Lines" from Time's Up. So the article reads, Usually recessions have a bigger impact on men instead of women. However, with the COVID-19 pandemic, women are experiencing more concerns regarding money than men. This is due to non-essential businesses closing temporarily. Businesses such as restaurants, salons, and businesses of hospitality have high rates of female employment, but their business has been deemed non-essential, putting them out of work without pay. This is proving that women hold more vulnerable jobs in society when compared to men. Men are also more likely to be able to work from home via online than women who have been left without jobs. Women are exposed to more face-to-face interactions than men and are needed to be physically at their job in order to work. And below, I have just included a graph that shows the percentage of women who need to work or who work in face-to-face jobs and the percentage of men, the right being women. So, women are also more likely than men to be a single parent. Because a woman is trying then to support herself and her child on one income, and during COVID, many no income, women experience more economic stress. With job losses, the source of income is now gone, but the need to take care of one's child and oneself still remains. For women who have not lost their job but are instead working from home, they too are experiencing hardships. With schools and daycare centers being closed due to being deemed non-essential, not only are women who are working full-time from home, but they are also taking on much more responsibilities within their households. Women became in charge of homeschooling their children, cleaning and cooking. Since families are staying home all day, every day, more chores are arising in the household. More cooking is being done. All food and meals are being eaten at home, which then leads to more dishes. Domestic household chores like these often land on the woman. So, next, I want to talk about how violence against women is rising during this time. So, as the pandemic intensifies and stay at home orders have been put into effect, the number of reports have dramatically increased. In the UK, deaths due to domestic violence from April to March 2020 have nearly doubled. In Jiangli County, China, reported cases of domestic violence has tripled. So, why is this increase happening? As household stress increases, so does the likelihood of intimate partner violence. With stay at home orders, families are spending more time in close contact, changing the way that we live. Due to the stress of changing the way one lives, more violence is unfortunately a result. To fix this problem, governments have been required to include essential services to help serve domestic violence victims. Governments must still provide response plans, resources, and means to make these resources accessible during social distancing. Then to the left of this page, I have just included some domestic violence resources. So I have included the domestic violence hotline. You can call or text that, the Woman in Distress hotline, and the suicide prevention hotline. The next article that I chose to include is Leadership by Woman. I spent the most time researching this and I found it to be really interesting. So, nations that are led by women are seeing far lower coronavirus rates than nations that are led by men. I read this New York Times article by Nicholas Kristof, and he did a study that conducted death rates from 21 different countries. 13 were led by men, 8 by women. The male-led are experiencing about 214 deaths per million citizens by the virus. However, countries led by women experienced around 36 deaths per million. Every country that has experienced more than 150 deaths per million are led by men. So, what are women doing differently? The differences shown between women-led nations and men-led nations are that the women-led nations consulted health experts more often, they trusted them, and they took action quicker. Moreover, female leaders also seem to have a stronger focus on public health. In the United States, after women received the right to vote, votes for more money in public health and sanitation caused change to these realms in government funding, proving that women have a strong voice on public health. Another suggestion is that the citizens of the countries who have been elected a female lead are more open to change and seem to be participating more towards suggestions made by epidemiologists. The women who lead these countries also have a different way of communicating. The Chancellor of Germany, Angela Merkel, began her speech on March 18th by acknowledging her citizens' pain and suffering and said that they must work together to get through the pandemic. She then laid out how they were going to do this. In comparison, Donald Trump, our president, around the same time was blaming the media and Democrats for making the situation bigger than it actually was. Women-led nations communicate more effectively to their citizens. And then I just have included here a picture of Jacinda Ardern. She's the Prime Minister of New Zealand, and this is her giving a speech to her country regarding COVID-19. Next is the effective medical services for women. So, based on past epidemics, health supplies and resources are often obtained by taking it from routine health services for women. The hard hits are being sexual and reproductive health services. Other resources are being taken from maternal, newborn, and children's health services. Before the COVID-19 pandemic, Black mothers already experienced higher rates of mortality during birth. These numbers are rising during COVID-19 and are leading mothers to give birth in a non-hospital setting such as home or birthing centers. Women are also less likely than men to have access to important medical services. Men are more likely to have insurance given to them through their job. With COVID-19 testing rising, insurance will be needed, unless stated otherwise, to be able to get tested. Many women without insurance who are also going through economic hardship do not have the money or resources that they need in order to be tested. So, how can we overcome gender differences in our own homes? Step 1, split housework equally. So basically, sit down, talk with your family, figure out what needs to be done, and split that work equally, not basing any of it by gender. 2, talk about it. Just sit down, inform your family what gender inequality is, have a discussion about it, and talk about how you can fix it together. 3, caretaking can be done by both genders. Well, whether it is taking care of a younger child, the elderly, or someone who is sick, put responsibilities for caretaking on both the males and females of the household. 4, empower the next generation. Encourage children to have a diverse range of role models. Teach them to speak out about gender inequality and teach them what stereotypes are and how to prevent them from forming. Finally, we have the back cover. I just included women's health needs to be front and center. It often isn't, but it needs to be. It's a quote by Cynthia Nixon, and the final part of this magazine says this is a mock magazine. Since this is going on a public website, I didn't want anyone to be confused, didn't want anyone to trust solely this. I did research on it, but I don't want anyone to think that this is real, and I just needed to put that in there. So thank you.